So I'm going to be doing an IV insertion for my first video. So I have my chart here, and it's Jennifer Doe, and I'm looking at her orders, and yep, it says that she needs to have an IV placement. So right away I'm going to look at her allergies. She has no known drug allergies, and I'll verify with that once I get into her room. So I'm going to go ahead and wash my hands before entering, and then knock, knock, knock. Hello, Jennifer. Provide some privacy. My name is Marissa. I'm a student nurse, and I'm going to be placing an IV in your arm here today. The doctor has some fluids ordered and wants me to place that for you. And she says, okay. And I say, can you tell me your name and date of birth? And she says, it's Jennifer Doe, 11/5/1975. Jennifer Doe, 11/5/1975. Yep. Do you have any allergies, anything to cleaning or any allergies at all? And she says, nope, no allergies. Perfect, everything matches up. So then I'm going to go ahead and I'm going to place a protective pad. And I say, Jennifer, did you ever have an IV placement before? And she says, yes. And I say, okay, is there any specific arm that works better than the other? And she says, this one does actually work better than the other one, right in her AC. So perfect, so we'll place the pad underneath her. And then once that is done, I have my supplies gathered here, and I have a saline flush, I have the J tube, I have my needle, I have tape, I have gauze, I have my Tegaderm or cover dressing, I have some alcohol, tourniquet, and then I have some gloves, which I gotta grab a couple more here while I'm gathering my supplies. Alright. So then I am going to go ahead and place a tourniquet on her arm here. And when I'm looking for a vein, I'm going to look for a straight one, preferably distal from any joints. I'm going to have her clench her fist and to see if I can view the veins any better. If that wasn't going to work, I could also apply a warm compress to help see. And then right here, yep, looks good for the vein. The tourniquet I'm going to apply 15 to 20 centimeters above the insertion site, and I'm not going to leave it on for more than 2 minutes. So I'm going to release it right now while I get my supplies ready. So I'm going to go ahead and take my saline flush here. And when I open this, I'm not going to touch the diaphragm, keeping that sterile. I'm going to open this, make sure there's no water, or air, excuse me. And then I'm going to connect these two. I'm going to loosen the cap on the top, again, being very careful not to touch it to keep it sterile. And I'm going to flush some water through. So once that's flushed, I'm going to put this back in here. I'm going to have my needle open my gauze and my Tegaderm. And so I'm going to move all my supplies over to the bed. Okay. And then I'm going to go ahead and wash my hands one more time here. And I'm going to find my gloves. Alright, so then I'm going to apply my tourniquet again. When I do this, one other thing I should be looking for is palpating the pulse and make sure I can feel a pulse. And she does have a pulse present. So I'm going to go ahead and take my alcohol wipe here. And I'm going to cleanse in a circular motion. (15 to 30 seconds). And while that's drying, I grab my tape here. Alrighty. So once that's dry, I'm going to grab this, my needle, remove the cover. Okay, the catheter would be on there initially. I would remove my cover for my needle here, and I would have my bevel up. I'm going to pull the skin taut, and at a 15 to 30 degree angle, I'm going to insert the needle. A little poke here, Jennifer, okay? And I'm going to insert until I see a flash. Which I just did. So I'm going to drop my needle parallel, and then without touching where I inserted, I'm going to insert a 0.5 centimeters, a little more, and then I'm going to push the catheter in. I'm going to retract my needle here. I'm going to release my tourniquet. I'm going to take my saline here and I'm going to connect it. Again, without touching everything, I'm going to take this and I'm going to flush, asking Jennifer, are you having any pain or discomfort with that? And she says no. I'm going to see if I can get any blood return, which I am, and I'm going to flush a little more. So once that's stable, I'm going to take my gauze and I'm going to just clean around here without touching the site. Take my tegaderm, again holding in place, not touching the middle of the tegaderm. Going to place it, which is good. I'm going to take this, and I have my tape here to hold this in place a little better. I can remove this, and then on here it has your initials, date, and the gauge. So I can go ahead right away with my pen I got here and do my initials, the date, and my gauge. I can attach that. All right, and then I have that tape as extra in place. This is locked. Make sure I'm locked here. All right, and then when I'm finished, I'll pick up my supplies, throw what's garbage away. I'll put my needle in the sharps, and then I'm going to lower the bed back to the lowest position. I'm going to make sure Jennifer has her call light in place. I'm going to place the side rails up. If I could, I would. And then I am going to remove my gloves, wash my hands, and then once I leave Jennifer's room, making sure she's safe, comfortable, everything she needs, I'm going to go and I'm going to go document the IV placement, the time, where I placed it, the gauge I used, and how she tolerated it. I'll also look into modifications of lifespan for her, whether she was a younger child and needed a distraction, or like she said, she was somebody that had IVs before, so she was able to tolerate it pretty well. And that should be it.